Welcome to the SDG Media Zone, coming to you from UN headquarters at the ECOSOC Youth Forum. We are here to talk about why youth mental health matters. My name is António Pinho. I am a United Nations Foundation Next Generation Fellow, and I have here with me Nattanicha Kattiyavara from the UN Youth Office Youth Reference Group, and Martha Barreneche, Youth Advocacy and Wellbeing International Specialist at the UN Youth Office. Thank you so much for being here with me and for tackling this issue with me. So maybe I would start with you, Martha. So you do work for the UN Youth Office, and you have launched the Youth Mental Health and Wellbeing Flagship Initiative. So can you speak a bit more about the work that the UN Youth Office is doing with this flagship, and what are the main outcomes after, the first months of its launch?
Well, first of all, thank you for having us today. So of course, youth mental health and well-being matters. It matters to young people all across regions and continents. I personally also come from a very little city from Argentina. I've been working for the past, I would say, 10 years on the agenda and looking into little and larger communities, how it is important to address this issue and how it is important also for young people, especially after the pandemic. So in the UN Youth Office, under the leadership of Felipe Paulier, our first ever young ASG, yes, woo! So also the story goes back also to his political also career back as the youth ministry of Uruguay, where in the pandemic they've developed a whole programming on youth mental health. And so when he became ASG, he started traveling and he realized that this was a cross-cultural, cross-cutting issue for young people from the richest neighborhood in Manhattan to the poorest also city in any country, underprivileged country. And so that is when we decided to create this flagship initiative, but we decided to do it with young people. And so we went ahead and started asking youth why this agenda matters. And so we've mapped 700 youth-led organizations from all 5 continents, and we've developed an ecosystemic approach in which we acknowledge 10 dimensions of youth life, understanding that mental health is more than health. It's about advancing on different dimensions of the youth life in order for us to be able to thrive and to flourish. We cannot prevent young people from having an issue in life, but we can create ecosystems, environments that can help them overcome what they face.
Okay, of course, and that's amazing that you are doing that, and you are so considerate of what we often call the social determinants of health and also of mental health. But I was thinking that for the beginning of this conversation, you guys do such an incredible work at a macro level that I also think that the people deserve to know you. And, you are also young people thriving in this world. And nowadays, we know that, for example, between AI changing the job market and everything being so politically divided, it really is a stressful time to be young. It's not easy. So how do these modern, let's say, pressures affect your mental health? And how do you protect your peace while still maintaining and staying engaged with all of this process?
Okay, so basically most of the young people are able to access the internet, right? And for example, young people like to play social media platforms, for example, Facebook, Instagram, and many more. And when we play this social media, we can see how others are doing, and also we can see the trends, the news that is going on. And normally, sometimes many young people, they feel that they are being pressured and they are doing the self-comparison with themselves and others. And also sometimes when they read the news, and for example, as I read the news, sometimes I feel hopeless or feel depressed from the thing that is happening around us, and we feel that we should be able to do something more. Therefore, when this happens, mental health come in that these young people, they don't feel that they are enough. They start to have self-doubt and everything. Therefore, normally how young people navigate this is that many young people are taking time off social media. And also another approach that many young people, and also myself taking this, is that I try to tell myself that it's okay to feel overwhelmed. It's okay to feel stressed sometimes. I like to say that we feel a lot. It means that we care a lot. Therefore, we try to navigate this with self-compassion method, and we try to understand what is going on, and we need to understand ourselves as well.
That's a great point of view, and it's exactly why we need to have young people engaged, because only they understand this way to deal with all the pressure that is going around us, right? So I don't know if you have any more techniques that you use for yourself, or any other considerations that you have about how you can, keep on being peaceful when you are dealing with these issues.
Yes. So there is a saying also on the mental health space that there is no cure of being human. And so we are going to face struggles. We are going to be worried. We might also have, diverse feelings that might not be as positive as we'd like. But the importance there is to be enveloped within an environment, within a community, within a space that can help us overcome and thrive. And so many times also even recent reports show that there's this fear of being judged. So many times the mental health issue is about creating this context in which young people can speak about what they feel. I personally also do that. I have my friends, my family, even my colleagues many times. Also at the UN Youth Office, we try all the time also to share a little bit more other than work. We just come now from the meeting between the UN Youth Office and the reference group, and we were sharing also about our life experiences, our differences and our opportunities also together. And I think that those are the things that can help us thrive as youth. And I think that this generation is more than ready to share. We see that in social media, and we see that as maybe as a very interesting asset to advance youth mental health and well-being.
Of course, and it's really great that you feel like you have this, I would say, support networks actually in your lives, especially because when we talk about mental health, sometimes we feel like, that's not enough. We might feel like when we talk about mental health, we frame it as just a mindset, but really sometimes it's hard to be okay if you can't pay rent or you can't find a decent job. And, I would like you to think about your region, your own peers, and think, how do things like poverty or the lack of stable work in your region actually shape the mental well-being of your peers?
Okay, for me, I come from Thailand, so it's basically Southeast Asia. And Southeast Asia is a magical land. We have this amazing culture, but that culture also comes with some expectation. Expectation that I mean is that everyone expects you to be the best of yourself all the time. And when this problem, for example, poverty or lack of employment or education pressure come in, many young people and also adults as well in Southeast Asia, when we try to deal with this situation or the problem that we have, sometimes we are not able to manage it by ourselves, and sometimes they are a little bit scared to reach out because our culture say that we should not be bothered other people. We are very compassionate, therefore we don't want to bother, we don't want to make a big deal. But nowadays in Southeast Asia, I think the trend is going more caring. Is that many people, they feel that it's okay to ask for help, and also all the problem that they are facing, that you gave us the poverty or lack of employment. Nowadays there is many system or platform for young people to reach out for help. I think that is what is going on in Southeast Asia, and I think it's keep getting better, but still there are challenge that still exists. For example, the platform may not reach for some young people in the rural area, and I think that when times come, I think it can happen as well. So let's see.
All right, thank you so much. And for you, Martha, what do you think?
No, maybe I was trying to think also about experiences that I might have had in my home country. And I remember one time we were doing this exercise with some young people. We were asking them to identify a point in life of real distress, of real pain. And they wrote about it in a paper, in an anonymous paper. And then we asked them to list the people that they felt were close to them during that time, and then to count the amount of people. And so it was very interesting because culturally we are a very community-based also culture. We are all about, gathering the family on Sundays. We are all about soccer and, community also, sports. And so, but it was very interesting because after that day, there were 30 young people in that room, and we had, none of the 30 had more than 5 people. We had 15 that had only 2, and we actually had like 7 that had 0. So basically that shows us that in the moment of distress, the young people do not have not one person to speak to or one person to kind of address it with. And that shows also at a small scale what happens at a larger scale. Therefore, this community-based also approach to addressing youth mental health, I think, is very relevant, because there is where we can, find also the opportunities and maybe the cure.
That is a really great point. And it also speaks a lot about the idea that not only we have to bring young people into the room, but also with the regional representation, because things really change from one place to the other. So I do identify the value of that. So I want to continue with some questions regarding. And if you could, for example, sit down with a health minister from back home, what's that one hidden barrier to mental health support that you believe that they are ignoring? And what is your community doing to fill that gap when the official help isn't there?
Okay, I think if I can say what a minister, I think the thing that hasn't been addressed much yet is the condition of burnout and also mental fragility among change maker, or also the personnel relating to mental health field, for example, psychiatrists, psychologists. We also say many times that, okay, if you have a problem, if young people or anyone have a problem, we should go to them. But the problem is that these people who are taking care of us, taking care of our mental health, also have to face many things in their own life as well. And when we take a look back from the data, for example, in my country, the number of psychologists or psychiatrists is very low. That means that one psychiatrist need to take care of like 1,000 or many hundreds of people. Therefore, I think the thing that we're ignoring is that the capacity and the caring or support system for the people who are working to advance mental health access and mental health condition in general. I think that is the thing that I would address. Yeah.
So first of all, I think that definitely also linked to what you just shared with the Ministry of Health is about access, and it's about services, and it's about providing those spaces for young people. But there's definitely something that I would do, which is create a plan to engage the other ministries, because mental health, you cannot solve the problem once and for all. We need to create an environment and an atmosphere around the youth life that protects and promotes youth mental health. That means that the Ministry of Health has to speak to the Ministry of Education and understand how in that environment we can promote and protect youth mental health. The Ministry of Health has to speak with the labor minister and try to understand what happens also on the labor with the pressure for young people. We have to sit also with the culture and arts minister and understand how arts can, and creative expression can help on the prevention and the promotion of youth mental health. So there's definitely there something cross-cutting that I would encourage a Minister of Health to do with the other ministries in order to really, really address this issue.
Of course, and I love that you brought up this cross-collaboration. I was actually thinking about what you said about this network of psychiatrists and psychologists, and there's also back home, I also think that one of the ways that my community has actually tried to help is to get these professionals into academic institutions, for example, universities, secondary schools. So really this need for a cross-collaboration is something that we really do feel deep within our community, and I think that we try to act there. But we're talking such a macro level. We're here in New York, we're talking about the Sustainable Development Goals. But does this high-level conversation actually reach a young person struggling with their mental health in their hometown? And how can we actually translate these conversations at a macro level into everyone's lives?
I think for me personally, I think that there is many kind of message going on in New York and also in the UN headquarters or worldwide. I think that for me, it seems a bit impossible that that message that we're addressing now will be access to every young people in my country or anywhere in the world. But if I can choose one message that we're here as a global scale, the thing that I would really encourage we to talk about more is that I want to remind everyone that it's okay to be tired sometimes. It's okay if you are undergoing a mental health condition, or if you are struggled, or if you are or burnout or something. It's very okay to take the time. It's okay to recognize it and ask for help, I would encourage that, and I want this message to go to every young people out there, also ministry or every adult who are working with young people, or everybody who is watching this. And I just want them to feel that it's okay, just be yourself. And I think that we take time and we all have a uniqueness in ourselves, so it's okay to take time, it's okay to be fragile sometimes. And yeah, I just want to make sure that this message that we're addressing in global level, we make sure that we do not leave anyone behind, especially in their feelings.
That's a beautiful message. Martha, how about you? How would you translate this?
No, I would also relate to this message on this caring component. It's okay. And so mental distress can be born out of something very simple, very little. A little pain can develop, if not accompanied and if not embellished within resilience, it can develop into something very, very serious for a person's life and for a youth life even more, because it can lead to even to youth suicide, which is a very real issue that we are facing globally. And so therefore caring and taking the time and saying it's okay, even if it's just a little thing, is definitely a message that I would like to send out as well. But also these platforms and these opportunities during something like NECOSOC Youth Forum is, is showing also that the UN cares about young people and young people's voices. And I think that there's a component also in our flagship around governance and civic participation, because when young people feel empowered and feel that we care about their issues, about what they're saying, about their perspectives, about their innovations, about their creativity, they develop, very interesting also mental components that can help them thrive. And so empowering also young people is also about mental health. Giving them a space to speak is also about mental health. Convening, spaces like ECOSOC Youth Forum is also about youth mental health and the future also of youth mental health. So definitely, I'm very happy to see this event also going this smoothly. And I would say that also at the end of our first day, it's already a success to see so many young people from so many places.
Thank you so much. This is an event at global level, but it really still is about community, right?
Yeah.
But, we could end up right here because these messages were incredible, but I really want us to just really quickly project into the future. And I would just ask you that with all the understanding that you have about mental health, all the engagement you've had with young people, how can you now we are going closer to the SDG summit, so how do you think that this knowledge would help us reframe the way that we understand mental health and the way we approach it in the future? Really quick, 1 minute maximum probably, so I would just ask, I know it's a tough question, but to end up high.
Okay, so I think towards the SDG summit, I think these insights from the meaningful participation of young people here in ECOSOC, I believe that the elements and all the insights that gather here will frame the mental health insights in the summit to be more, I think, more like young people focus, and also it will be more personal level as well. As Bianca suggests that the mental health condition can occur from just a little thing in your life until it's big. Therefore, I think that the message that we're spreading today and all the young people voices now, I think that it will frame the mental health plan in the summit to be more people-centered, more young people-centered, and also engage more of the personal experience and personal feeling.
Thank you so much. Martha, would you also support this message then?
No, yes, 100%. I support, yes.
Thank you so much.
I agree, yes.
It was a really nice way to end up this conversation. And thank you both so much for being here and for bringing such valuable insights into this conversation.
Thank you, António.
Thank you, António. Thank you, Martha.
Thank you.